spring training tickets just for making an appointment. Meteorologist John Weatherby, Money Radio 1510 at 99.3 FM.
Right now it's 74 degrees, and the Dow Jones Industrial Average up 7 points at 17,978. The S&P 500 is up 1 now at 2,089, and the NASDAQ up 13 at 4871. Reporting for Money Radio, I'm Ken Morgan.
The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. My name is Bob Roth, and you are listening to Health Futures, Taking Stock in You. And we're coming at you live from the Scottsdale Air Park here on February 13th, 2015. And we got a big weekend ahead of us. We've got Valentine's Day. For all you guys out there that have been procrastinating, you better get up off your butt and get yourself cards, get yourself chocolates, get yourself flowers for your loved one or honey, and make it a special day. And I know for sure my wife and I probably won't be going out tomorrow night because some view that as amateur night, and you know the restaurants do raise the prices a little bit, and for those young people they can definitely do that. For us old fogies, we're going to probably be staying at home. But also there's a great movie that's coming out, that is out, 50 Shades of Grey. I think that's going to probably break some records this weekend. They've been advertising that a lot. So I wonder if there was that parallel with the fact that it's Valentine's Day, 50 Shades of Grey. Maybe there's a connection there. So we'll see what happens with the box office. I'm sure they're going to have a big smashing record this weekend. And then I also want to give a big shout out to my father, who is celebrating a birthday on Sunday. My dad's going to be 79 years old, and I get the pleasure of going out and playing golf with him and then going and having an incredible meal with my father. So happy birthday, Dad. 79 years old. You're 79 years young, not old. And on that note, I'm here today, and I've got a guest with me, and I handpicked this guest, and it was actually somebody that my father said I needed to visit with, somebody that has some experience in a certain kind of medicine that is growing. And as many of our listeners know, our show is about how to live a healthier, happier life. And we target our aging adult population because that is what we do at Cypress. Cypress, we provide home care and enable so many of our aging adult population to be able to live a successful, independent life, as much as independent as it can be, at home. And I have a gentleman here in the studio, Dr. Bernstein, here with me, Dr. Scott Bernstein, and he's with Scottsdale Private Physicians, and it's a concierge medical practice, and I want to welcome you to the show.
Thank you, Bob. It's a pleasure to be here.
It's good to have you, Dr. Bernstein, on the show. And you are practicing concierge medicine. And concierge medicine is something that is relatively new. And I would like you to just take our audience through what is concierge medicine.
Okay. Well, concierge medicine is a form of direct pay medical practice that is outside of the third-party payer system, meaning that the contract is directly between the patient and the doctor. There's no middlemen, i.e. no insurance middlemen. And so that way, the sanctity of the doctor-patient relationship is honored in its highest level. It's direct, it's private, it's confidential, it's unburdened by the hassles of third-party payers.
And you've had your practice here in Scottsdale for a few years. How long have you been in the business?
Okay. Close to 19 years.
19 years.
And then 7 years ago, I converted my practice to the concierge model. Prior to that, I did accept insurance, and I was working 80 to 110 hours a week to make ends meet, and also to give the time that I wanted to give to my patients.
And I think that last statement is really a profound statement, and I think you and I talked before we came on the air. That was one of the driving factors for you to start concierge, is to give the time to your patient. You told me, and I'm not surprised because I have a few friends of mine that are physicians. Dr. Bernstein, you said that you spent, prior to starting this practice 7 years ago, 80 to 100 hours a week. And that's because you wanted to give those patients more than the 7, 8, or 9 minutes per visit. You wanted to give them that time.
Exactly right, because my approach to medical care has always been an individualized, personal approach, and you just can't do that in a 7 to 8 minute window. It takes time to develop a relationship with the patient, to have a conversation with the patient, to really understand what's going on with the patient's life and how it impacts his or her health.
Do you think that, and we're seeing more and more of these concierge practices, and you started your practice 7 years ago, and I think that was probably prior to the Affordable Care Act, but not shortly thereafter is when the Affordable Care Act, started getting talked about, and now it's in place. Do you think that has been a big reason to drive a lot of these concierge practices? Because there are doctors like you that want to do more, but can't do more because of the reimbursement system, the way the health plans work, Medicare works, and they want to do more.
Absolutely, yeah. Since the advent of the ACA, the number of physicians converting their practices to concierge has skyrocketed. And in the Scottsdale area alone, at the time that I converted my practice, there were only 4.
Wow.
Now there's about 30.
Wow.
Just in the Scottsdale area.
And just to give our listeners a scope of that, and it's amazing how, just in 7 years, there went from 4 to 20. And I've, with Cypress Home Care Solutions, my family and I started this company almost 21 years ago. And when we started this company, there were less than 10 companies in the entire valley that did what we did, and that is what some people call non-medical, but it's in-home care service work, attendant care work. There were less than 10. Now there are over 700.
Wow.
It is amazing. It's a sign of the times, but, people are aging. And we have an aging adult population.
And these people need care.
They definitely need care. And, one of the things that I saw on your website when I did a little bit of research, and I do that from time to time when I'm going to have a guest on, I saw that your specialties, your area of specialties, are internal medicine, age management medicine, and concierge medicine. And I know we're coming up on a break, but I want to be able to talk to you a little bit about this age management medicine. I would imagine that's probably a fairly big part of your practice.
It is. A big part of age management medicine is twofold. One, to be proactive and prevent a lot of the consequences of poor lifestyle choices. And then the second part is whatever condition the patient is in, heart disease, diabetes, whatever, to do our best to optimize their health in that regard. And I'll tell you more at our next segment.
We're through our first segment. Are we having fun yet?
We are.
Well, you're listening to Health Futures, Taking Stock in You. We'll be right back.
Andrews Law, the go-to lawyers for your business and entertainment law needs. Whether you're a soon-to-be business owner, an artist, or an experienced deal maker, you'll probably come across a contract or two in your career. For most people, contracts can be confusing, frustrating, or just plain ineffective. The last thing your new music deal, purchase agreement, or real estate contract needs is miscommunication or a jumble of legal jargon. At Andrews Law, we cut through all the fluff and produce work that is professional, easy to understand, and rock solid. So, don't just scan the internet for templates. That free contract you download today might just cost you hundreds of thousands of dollars tomorrow. Get the job done right from the start with Andrews Law. We're the go-to lawyers for all your contract and copyright needs. Call us today. Don't wait. Dial 888-955-9111. That's 888-955-9111.
Hello, I'm Jim Gentrup, Principal Partner with Valvista Capital Management. At Valvista, we focus on small company stocks. We offer our clients over 25 years of research and portfolio management experience. Our clients, many of whom are high net worth investors and lead busy lives, entrust Valvista Capital Management to create additional wealth through small company stocks. In addition, the principals at Valvista Capital Management, unlike many money managers, have a significant portion of their assets invested alongside our clients. You should invest too, so call today at 480-646-4537. Our goal is to create long-term value and a trust-based relationship with our clients. Learn today how you can successfully invest in small company stocks with reduced volatility by calling Valvista Capital Management. The number again to call is 480-646-4537. That's 480-646-4537. You can also learn more at www.valvistacm.com. That's www.valvistacm.com.
SRP Business Solutions offers a variety of rebates for all kinds of energy-saving options, including refrigeration, window film, lighting, and heating. Learn more at SaveWithSRPBiz.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. My name is Bob Roth, and you are listening to Health Futures. And I'm here with my guest, Dr. Scott Bernstein from Scottsdale Private Physicians. He's a concierge doctor practicing right here in Scottsdale, Arizona, and we're coming at you live from the Scottsdale Air Park. If you missed our first segment, you can catch it on our website at cypresshomecare.com. If you scroll down about halfway down on the right, you'll see a radio microphone. Click on that. You'll catch this episode, and you'll catch about 52 others that we've done, and we've been coming at you since January 2014. So, Dr. Bernstein, we were talking about the age management medicine piece. And at the break, we were talking about something that's really near and dear to both of us, and something that our aging adult population needs to be more mindful of, and that is staying upright, staying vertical, and not having falls. And I was sharing with you, there's a Dr. Bernstein here in town that owns a company called Brain Savers, and he's got a whole regiment that does physical and cognitive training, and I attended one of the sessions, and it was amazing. He had over 30 people there doing these exercises, and most of them were using just very light dumbbells, but many of them were just body weight. Mm-hmm. And so much of the focus was on balance, and balance is so important.
Very much so. And also, what's essential for the balance is a strength in your legs and your core. The way to visualize or to feel that is just get in and out of a chair without holding onto the chair rails. The muscles you use for that, those are the muscles that are the most essential for preventing falls. They are.
They are totally essential, especially using your legs. And it's amazing for me, and you probably see this. I'm holding one of those jawbone up 24s.
Okay.
And there are a lot of people that are wearing what they call wearables today. And, this thing counts my steps, but it also counts my sleep. And, sleep is something that I want to be more mindful of as I've gotten older, because I get less and less of it these days. So, I'm one of those guys that likes to be accountable for my time. And my steps, I get competitive with myself. These things come, I think they started with 10,000 steps, but, my goal is 15,000 steps a day. And we're not talking running marathons. We're not talking running sprints. We're just talking about moving. And we were meant to move.
Exactly right. Our bodies are screaming for movement. A phrase came across my way a few months ago that sitting is the new smoking.
You know what? I totally subscribe to that. My wife, Susie, subscribes to that. She tells me all the time, sitting is bad. You need to get up, you need to move around, and as a result, about 8 years ago, she got a treadmill desk, and I followed very shortly after. I bought one for my home office and one for my work.
Wonderful.
2.5 years ago. And even if the treadmill's not going, I'm standing at the desk.
Right. And that's and I do the same thing. I'm walking around. I have a mobile headset for my phone at the office. When I'm in the exam room with my patients and having a session with my patients, I'm maybe 10% of the time I'm actually sitting. The rest of the time I'm moving around the room, demonstrating exercises, having a patient do the exercise with me as part of our session, because movement is so essential and it's so easily neglected in our culture and society.
You know, my wife Susie has this saying, and that is, a body in motion stays in motion. And, you know, there's
beautiful.
There's a lot to that. And you know what? If there's anything our listening audience walks away with today, beside Dr. Bernstein being this great concierge doc in Scottsdale, is the fact that, one, you need to stay vertical and prevent falls. Two, the way to do that is to move and to do some even simple body weight exercises like squats, body squats.
Body squats, planks, like push-ups. You don't have to do a whole lot of them. It's just you start where you're at. Just get into the position and feel the muscles working, and then get yourself into a squat position from the plank position. And there's everything you do, make it an opportunity to use your body the way your body wants to be used.
And wall sits.
Wall sits are wonderful.
They're hard.
Yeah.
They're really hard. Your knees start shaking, your legs start shaking, but man, they are good for you. And you know, you see a lot of the older adult population. You go to these senior centers, you go to these adult living communities, and you see a form of exercise called Tai Chi.
Mm-hmm.
And there's a reason that they are studying this Tai Chi, and it's all this choreographed motion, but it is motion. It's standing up. It is, you know, working your core and working your body.
Yeah, it's a wonderful form of exercise. For those people who are afraid of learning all the routines, just make up your own.
Yeah, you can make up your own, but you know what else?
What's that?
The internet. I mean, there's so much up on there that you can download YouTube or just stream YouTube exercises at home, and you can just participate along with them. And if not, you know, the other thing that my wife and I both subscribe to is audiobooks. And, you know, listen to some audiobooks as you're walking, as you're doing some stuff around the house, but sitting is the new smoking. I like that. Yep.
And so movement is key. And I can't say enough about it. I'll add one more bit about it. In my own schedule in life, my 5-year-old daughter is the inspiration of my exercise program. Keeping up with her is my goal. And when she wants me to dance with her or to pick her up, it's an opportunity for me to use my various muscles. And so I've seen some parents say, oh, can't do that. You know, it's going to hurt mommy or daddy. I say, come on, let's do it. And I pay attention to the mechanics of my body. I had her standing on my shoulders, walking. She walked up my body from her feet started on my knees, up my thighs, my belly, my chest, and then she kept walking up, and so she was actually standing on my shoulders, and I was holding her hands.
And you were doing this from a standing position?
From a standing position.
Wow.
And then I went ahead and did some squats with her up there. And then I did some toe raises with her up there.
Simple stuff.
Simple stuff. It was a workout.
Simple stuff.
Yeah.
And you know what's interesting too, Dr. Bernstein, is that, you know, you mentioned picking up your daughter. And, you know, there's another point I want our listening audience to hear, because I experienced this in the business that we're in. And one of the things that we have that no other home care has, at least not to the level that we have, and I think we were the first one that had one across the country. We've had it for almost 11 years, is a caregiver training lab. And the purpose of this lab, we have 16 pieces of medical equipment. We got 2 life-size mannequins, both weighing 167 pounds. You talk about dead weight.
Yeah.
And one of the things that we do in there is we practice with our caregivers, both experienced and unexperienced, on how to properly lift a patient or a client using proper body mechanics. Because just like you said, you went to go pick up a 5-year-old, and for our listening audience, listen in. Do not bend over and pick up your 5-year-old. Bend with your knees first. Because if you try to bend over and try to lift this 5-year-old, 6-year-old, 7-year-old, 3-year-old, you're liable to throw your back out.
Absolutely.
And it's using very good, proper body mechanics. And I'm talking about engaging your abs, engaging your glutes, bending from your knees, and properly lifting. And I'm talking about lifting groceries from your trunk.
Right.
Don't bend over and lean over. Bend from the knees.
And don't forget luggage at the airport. So many patients will come back from a trip not understanding why they have a sore shoulder or a sore back.
Yeah, absolutely. Well, we're here with Dr. Bernstein. He's got a concierge medicine practice. And, these type of concierge medicine practices have been growing. And, one of the things I wanted to ask is, they have something that's called quality outcome differences. And, I tend to think that it's hugely beneficial on the concierge side. But do they have some measured statistics in terms of outcomes with patients that are part of your practice, and not necessarily just part of yours, but part of the concierge medicine practice, versus those that are going to, general practitioners, family doctors that are what the norm is that is out there?
Well, that's a great question, Bob. It's difficult in the doctor-patient relationship to measure outcomes. There was one study that I came across my desk last year that was a project of a corporation that helps doctors convert their practices called MDVIP. And one of their doctors here in Scottsdale participated in that study. I don't remember the details of it, but if you were to look at the MDVIP link, you could probably find a citation of that paper. And they did do some measures. They were able to do that because of electronic medical records.
Got it.
Okay. And so that's a big help that way. I use electronic medical records, but I'm not part of a corporation.
I used, and I asked you that question because there's so much data out there in terms of outcome-based medicine.
Oh, yeah.
And I know, and I hope to have a guest come on my show that we're having some discussions on, and that's talking about just the environment of someone's, whether it's a hospital room or their room in a assisted living community or in their house, to promote good, healthy living and good, healthy lifestyle. Well, it sounds like we're down 2 segments. Dr. Bernstein, it goes by real fast. We're having a great time here in the Scottsdale Aero Park, right here at Money Radio Studios, 1510 AM, 99.3 FM. You're listening to Health Futures, Taking Stock in You. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 and 99.3 FM.
Still more snow for Boston. Meteorologist Jennifer Gray says another blizzard will move into New England tomorrow.
And we already have a blizzard watch that we do have in place. This is beginning on Saturday night through Monday. It will go in effect. It's anywhere from the Cape all the way up through coastal Maine. We could see gusts up to 70 miles per hour.
And wherever you live, the airlines say call the airport first if you plan to fly for the next few days. The murders of those 3 Muslim students in Chapel Hill, North Carolina is drawing world attention and comment from Turkish President Erdogan.
In North Carolina, there are 3 Muslims who have been killed. President Obama, Mr. Kerry, Biden, at this point have not made any declaration of respect. And this is very significant. These people were not terrorists.
Gays and lesbians can now get marriage licenses in more than half of Alabama's counties, and the Dow has broken the 18,000 mark. I'm Evan Haining.
Data knows you love posting selfies. Others might see a reflective surface, but you see an opportunity. Like right now, you just caught a glimpse of yourself and you like what you see, and you're thinking, everyone else would probably like it too. Go ahead, you've got more data and you're paying less with Boost Mobile. For only $35 a month, you can take your selfie game to the next level. Parked car window, click, selfie. Person wearing sunglasses, click, selfie. Anything shiny, don't mind if you do. You, my friend, have no selfie control. And Data's okay with that. Come to Data.
Now get unlimited talk, text, and 2.5 gigabytes of high-speed data for $35 a month after you sign up on Auto Reboost, only from Boost Mobile. Enrollment in Auto Reboost required at activation. Removal of Auto Reboost increases plan costs to $45 a month. Video streaming limited to 3G speeds. After applicable data allotment reached, data speeds reduced to 2G speeds for remainder of plan cycle. State and local sales taxes may apply. Restrictions apply.
Let's make 2015 a year to remember by making the most money and making the most of the money we make. We're your helpful guide. Money Radio.
Move over. TD Ameritrade and Scottrade. There's a new leader in the pack of the finest trading platforms in the country. That's right, Phil's Easy Trade platform, designed by professional traders, and is why it's so easy to navigate, so easy to execute, and includes the most important and advanced features that give both professional and novice traders the edge they would expect. So simplistic, so stealth-like to assist you in building your profit center. For information on Phil's Easy Trade platform, go to philsgang.com or call 877-600-GANG.
That's right, folks. philsgang.com now offers a stock trading and investing platform. This unique platform is fast and designed for performance with the integration with PTT1 and PTT2 stock charts. It will also be tailored to the way that Phil's Gang teaches you in class. For more information, simply go to philsgang.com or call 877-600-4264. 877-600-4264. That's 877-600-4264.
Attention boomers and retirees. Do you own a high-risk, high-fee variable annuity or an obsolete hybrid income annuity? What you don't know may potentially jeopardize your future or current retirement plans. Call Anil Vazirani and Secured Financial Solutions at 800-957-5604 extension 200 to set up your complimentary strategy session to learn about a possible superior solution. Learn about the concept of the principal protected low-cost new generation annuity and why it's superior in most cases than the high-risk, high-fee variable annuity and the obsolete hybrid income annuity. Call 800-957-5604 extension 200 to set up a strategy session or go online at www.theripa.com. 800-957-5604 extension 200. Call today. Annuities are not suitable for all investors. Benefits based on claims paying ability and Comdex rating score. Investment advisory services offered through Brookstone Capital Management, an SEC-registered investment advisor.
Giving chocolates for Valentine's Day is a given, but what kind? Russell Stover is America's favorite heart box. Give her what she's hoping to get. Give her Russell Stover.
This is Ray Hoffman with Your Money Now. Those consumer sentiment surveys, oftentimes it seems as if they're tied right into the price of gas. With retail gasoline prices up about 9% this month nationwide, the University of Michigan Consumer Sentiment Survey, which at the end of January was standing at the highest level since 2007, has rolled back to where it was at the end of December. The preliminary report for February shows about a 4.5% pullback in consumer sentiment. The AAA nationwide average for regular gas is up to $2.24 a gallon versus $2.17 last week, $2.12 a month ago. There's a further rebound in oil prices today. West Texas crude's up 2%, over $52 a barrel. The business of cold weather gear was hot going into the winter. The shares of Columbia Sportswear are up 15% today. Sales rose 27% last quarter. The Dow has backed away from the 18,000 mark, showing a gain of 8 points at last check. The S&P up 1, the NASDAQ up 13. And that's Your Money Now.
I don't care what they say. If you own a business, you did build that. You faced the tough challenges and you made the smart calls. So if your business is growing and you need more space, make the smart call today. General Steel. Our buildings have been used around the world, saving our customers as much as half the cost and time of conventional construction. As much as half. If your need is for storage and manufacturing, sure, we're the best. But with our custom exteriors and designs, General Steel buildings are used as offices, churches, retail stores, and more. Imagine a 5,000 square foot building for less than $35,000. Or even 10,000 square feet for an unbelievable price under $75,000. These are prices you just can't ignore on a building designed specifically for you. Make the smart call and call General Steel today at 866-95-STEEL. Save as much as half the cost of conventional construction and own the space you need. Call 866-95-STEEL. That's 866-957-8335.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. My name is Bob Roth, and you are listening to Health Futures, taking stock in you. And we're on our third segment, and we're here with Dr. Scott Bernstein, and I want to jump right back into it. Tell me a little bit about how our listening audience can get a hold of you, and tell us a little bit about, some of the intricacies of your practice.
Okay, well, two ways to get a hold of me. One, through my website, scottsdaleprivatephysicians.com, and my phone number is on there. Also directly, my phone number is 480-767-7699.
Now, is that the office phone number? Is it your mobile number? Or is it both?
That's my office phone number.
Okay.
And that brings up a good point about my practice. One of the several benefits of being a patient in my practice is the ease of access to me, either during office hours or, if you have an urgent matter, after office hours or on weekends or holidays. Each of my patients gets my personal cell phone number, so that way they can contact me directly, not through a pager system, but directly on my cell phone for an urgent matter.
I want to share with our listening audience, I mentioned at the top of the show about my dad's birthday, and he's 79 years old this Sunday, and it's interesting. It's not a coincidence that Dr. Bernstein's here with me today. I remember a couple years ago, my father was a little disenchanted with the system that he was in, the healthcare system he was in, and he says, I need to find a doctor. And I said, where do you want this doctor to be? And he said, well, in Scottsdale. And I said, well, have you thought about calling Scottsdale Healthcare Foundation? Because you've been a benefactor to them for almost 30 years, and they know you very well. And I'm sure they know, some of these doctors. So, Dr. Bernstein's here today because he's my pop's doc, and he's been taking care of him for a number of years now and doing a great job. So, I wanted just to share with our listening audience. I don't think I've breached anything because, it didn't come from you. It came from me in terms of HIPAA today. But it's interesting because, as you say, they can get a hold of you. A year ago, my father was in Cancun and was having some health challenges. And, from in a foreign country, he's on the phone talking to his doctor. And that is very gratifying to me to know that he could reach out and grab you and talk to you about what he was dealing with. And you help him through those challenges. And I appreciate you helping him through those challenges.
It was my pleasure.
While we talk about your practice, you do some other things that are unique and different. You have email.
Right.
So it's a secure email.
Right. We have two kinds of email. We have regular email, so if a patient wants to talk about administrative matters or just share some information that's not private or personal, it can do it through regular email. But then we have a secure email for medical information, medical concerns. And so this way, the patient has to log into that system, and so they're assured that their questions and information and any responses I give are strictly confidential.
I like that. And I know your patients definitely like that. And certainly that meets the code of the HIPAA rules,
right.
too. There's encryption and there's protection and stuff like that. One of the questions I had for you, too, is that, this type of concierge medicine, some people refer to it as direct practice care models, if you would, DPCs. There are various price ranges, and you're a little bit closer to it than I am. What would our listeners see in terms of price ranges on concierge medicine, especially right here in Arizona?
Well, right here in Arizona, I would say the range is anywhere from $1,500 to $8,000. Depending on the type of practice, whether it's office-based or home-based. The home-based practices obviously cost more. Also, too, if the practice is part of a large group or a corporation, they might be less expensive, but usually each doctor has more patients on the less expensive one.
Got it. So if I were to sign up for your practice today, I pay a fee. How many times do I see you as a result of that fee? How does that work? Do I see you once a year for an annual checkup? Do I see you as needed? I mean, I think one of the things I know about concierge medicine is I don't have to call, because this is why my dad moved out of that system he was in. It would take him 6, 8, 10 weeks to get an appointment. Not the case in concierge medicine.
Right. Instead of having 2,000 or 3,000 patients, I limit my practice to about 200 patients.
Okay.
And so I'm usually able to, if a patient needs to be seen the same day, I'm usually able to do that. And that's very different from what your dad experienced in his previous healthcare system. And my patients appreciate that, and they respect it as well.
That's awesome. And you know what? That is peace of mind today, especially with some of the stuff that we're dealing with in this time of year. A lot of upper respiratory stuff you're seeing.
Oh, yeah.
What else are you seeing in the practice today?
Oh, right now it's been the allergies are hitting full force now.
It's amazing.
The warm weather has really stuck earlier. We usually have a brief thaw, but this has been lasting longer than most of us remember. Blossoms are sprouting up everywhere, and I'm the canary for it, too. I have my challenges with allergies. So allergies is a big one. I haven't had as many flu cases as I might have expected, but again, I only have a couple hundred patients. I have had maybe a handful of flu cases.
You recommend flu shots?
I do.
Okay.
I do. Even though it's hard to predict how effective each year's batch will be, because it's hard to predict which form of the viruses will be predominant. That's always a educated guess game that the experts are doing. This year, a lot of people are frustrated that the vaccine is even less effective than usual, but that's because the experts got surprised by the virus.
Right.
It's like trying to predict the weather.
And one other thing I want to ask you before we come up on a break is you talk about immunization. Vaccinations for flu.
Yep.
This measles thing is blowing my mind. I just don't understand, and I know that maybe I have some naysayers that are listening in our listening audience. Mm-hmm. Why would you not immunize your child if we knew modern medicine will prevent you from having that disease? And I'm talking about the measles outbreak. Right.
And I agree with you, Bob. The evidence that these immunizations cause autism,
it's been debunked.
It's been debunked.
Absolutely.
My child has gotten every single immunization.
Have you seen any cases of measles in your practice? And I'm not talking just concierge, but even prior to that, the 19 years you've been practicing?
Not a single case.
I got to tell you, I've talked to at least a half a dozen doctors. Only one has ever seen. They've read about it. Right. They were taught about it, but no one's ever seen it. We're starting to see it now. Scary times ahead.
Yep.
Well, that sounds like we're up for a break. We can pick up on this conversation when we come back. We're down 3 segments, Dr. Bernstein. We got one more to go. I'd like to say we saved the best for last. So tune in to the last segment. You're listening to Health Futures, Taking Stock in You. We'll be right back.
Hi, Bam Ransom here, along with Johnny Dean
and Rick the Professor Plum.
We know how important financial planning and wealth education can be.
So we're focusing the show on the investment strategy designed for the needs you have today
and the goals you have for the future. Join us for Bucket Strategy Investing. Bucket Strategy Investing.
Answering questions about your most important financial challenges, your 401ks, IRAs, Social Security, and more.
Join us every day for Bucket Strategy Investing.
Join board-certified and personal physician Dr. Carrie Bordinko every Saturday afternoon at 1 p.m. on Money Radio 1510 AM and 99.3 FM for Doctor Talk, where we put healthcare back in your hands. Each week, we'll have a full panel of nationally known medical experts as guest speakers, taking an in-depth look at the issues that affect us all and matter most. Tune in this Saturday at 1 p.m. for Doctor Talk.
Is the U.S. shale revolution a good or bad thing for America? Hi, this is Troy Eckert, CEO of Eckert Global. Every Monday at 12 noon on Money Radio Station AM 1510 and FM 99.3, we will present a segment called Energy 101. Everyone listening on this radio station is affected by the price of oil, natural gas, and the shale revolution taking place in America. Again, Troy Eckert, Eckert Global. Be there at 12 noon every Monday, Money Radio 1510 AM, FM 99.3. See you there.
Hi, I'm Randy Reisen of Travick Home Remodeling. Join me and Sinclair Noe this Friday at 4:35 p.m. as we discuss a very important topic, your parents. Are they getting to the age where they are going to need more of your help? Have you been on the fence about setting your loved one in assisted living or other long-term care arrangements? Let Travick Home Remodeling show you the economic and social benefits that can be had for your whole family by simply providing a private casita or guest house for the ones who loved you the most. Visit us at Travick.com, Travick.com.
Whitman Sampler is America's favorite box of chocolates. Give her melt-in-your-mouth chocolates for Valentine's Day. Give her the Whitman Sampler.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. My name is Bob Roth, and you are listening to Health Futures, taking stock in you. And if you're just tuning in, I've got Dr. Scott Bernstein here in the house, and we're talking about concierge medicine and how that is your best solution for primary care. And we came off our last segment, we were talking about flu shots, and we were talking about getting those and the efficacy of those, and then we were also talking about measles and getting the MMR vaccinations for our children. Now, Dr. Bernstein, you and I are close in age, and I remember going in school when the school nurse had that thing that looked like a gun, and we rolled up our sleeve, and they immunized us. And, for me, I just think that it is really crazy that this measles has now reared its ugly head again, and we really eradicated it. And you talked about at the break how, polio, smallpox, we have vaccinations for all these things. And it's really incumbent upon us, not only for the safety of our own children, but everyone around us to be able to be doing these things. One doctor I was talking to, and he was going back to his medical school training. He had never seen measles before. But, I had asked him, I said, if a infant or a young child, because I don't think you can get immunized until you're like 2 or 3 years old or older,
right,
got exposed to this, do you remember the mortality rate? And he said, I think I recall it being 30 to 40%.
That's right.
So, for everyone listening in, these things do work. We as a society have eradicated these diseases. We need to be smart, not only for ourselves, but we need to be smart for everyone around us.
Absolutely.
So it's hard to believe we're down to our last segment, and I've learned a great deal about concierge medicine, and I know, Dr. Bernstein, you've won a number of awards, and you probably aren't aware that I did some research on you, but Patient's Choice Award 2009 to 2012, Compassionate Doc Recognition Award in 2010 and 12, and Top 10 Doctor by City 2014 for the city of Scottsdale. Cypress, we've won a number of awards too, and recognition is a really nice motivator for us. It's not the reason why we do these things. We do these things because we want to provide exceptional care for the people that we serve. But it is nice to get recognized, and you've gotten some nice recognition. One of the other things that we talked about, too, was we were talking about University of Arizona Medical School. And I know you're on the faculty there.
Yep.
And, it's interesting how our town has changed. And we were talking about downtown medical school in Phoenix, Arizona. And, there are over 10,000 students that live in downtown Phoenix. And it's hard to believe because 7 or 8 years ago, nobody was there. It really has grown. And I know I shared with our listening audience that I serve on the board of our Banner Alzheimer's Foundation. And Banner Health made an acquisition very recently that just got approved by the Board of Regents. And that was the acquisition of the University Hospital down in Tucson. And they're bringing that whole philosophy not only within Banner, but they're also going to be changing the name to Banner Good Sam to, I think it's going to be called University Hospital here in Phoenix. And as you know, and I know you trained at Banner, it's a teaching school.
Yeah.
And it's one of the finest teaching schools in the Southwest. And now we've got the University of Arizona emblazed on that, and that's a good thing.
Very much so.
It's amazing how much has changed here in our community in terms of what we have in terms of resources to help our aging adult population age gracefully, age successfully, and age in place, because that's ultimately what we all want to do.
Right. We all want to keep our independence for as long as we can. And that's why when we get to a certain point where we need help with our activities of daily living, what are our options? We can go to a nursing home, or we can get assistance in our own home. And the vast majority of my patients, when confronted with this choice, all choose having home care, because your home is where you have your history, it's where you're familiar, it's where you're comfortable, it's where you have more control over your life. And so home care, for the vast majority of people, is the choice to make. There are times where perhaps a skilled nursing facility might be needed, but I think those are in the minority. I think the vast majority of patients that need help can get it at home, and home care agencies have provided a wonderful service with that. Over my career, I've been the medical director of a few home health agencies. I'm not currently now, but I got a chance to see from the inside, from the caregiver's perspective of these home agencies, the kind of care and the kind of passion for care that these providers give.
I talked earlier about outcome-based medicine, and, I think you see it firsthand in your practice. People do so much better at home.
Very much.
And home is where they want to be. And the nice thing, too, is that we can surround people in our community with lots of care. And it's not just home care like Cypress, which, we encourage. But if somebody does progress in whatever challenge they're dealing with, the acute illness they're having, a physical issue that they're dealing with, if they need home health, they can get that at home. I had somebody on last week talking about hospice care. Over 90% of the hospice care that is being done is done in the home. I think most consumers out there, most people in our communities think that you go to a place to receive hospice.
Right.
You get it at home.
Yeah.
And you shared with me that if you've got a patient that is not feeling well and can't come into the office, you go to their home.
I do.
So, so much can be done at home today, and there's no reason, if you can stay at home, why you shouldn't.
Right, I agree, and I do home visits, and I actually enjoy them because when you meet someone in their own home, you learn a lot more about them.
Yeah, Amen to that, Dr. Bernstein.
Just by osmosis.
You get to see how they live. Try opening up their refrigerator. You get to see how they eat.
Oh, yeah.
You get to see a lot of the things about an individual in their home. And I think it's real important for us as practitioners, whether we're home care agencies, whether we're clinicians, whomever we are, that we be mindful of that home, because that is going to be the place where they are going to live, and they are going to be able to get well and be able to keep, as we all want, keep them out of the hospital. And certainly there can be things in that home that can send them right back, and they can be safety related. They can be not getting the right nourishment. It could be a number of reasons. The other thing that we talked about today, and I just want to reiterate it, is we talked about moving. And for our listening audience, Dr. Bernstein gave some great tips and some examples of what you can do, and I got the chance to share a little bit with our listening audience about something that I witnessed today or this week with Dr. Paul Bentheim, and that is doing exercises. And we're not talking a lot. We're talking body weight stuff, and really helping to really strengthen the legs and strengthen the core, because we need to keep people vertical. The statistics are overwhelming with falls. If you're 80 and older and you take a fall, you've got about a 50% chance of mortality. We're coming up to the end here, and I want to be able to give to our listening audience how they can get a hold of Dr. Scott Bernstein, because you've been a delight to have on the show. I did share with our listening audience, you're my pop's doc, and you're doing a great job with him and his wife, Maddie. I wanted to let everyone know that they can reach you at ScottsdalePrivatePhysicians.com or call you at 480-767-7699. We're wrapping things up. Any last sentiments you want to share with our listening audience, Dr. Bernstein, as we come to a close?
Well, I want to thank you for having me, and also to everyone in the audience. Enjoy this beautiful weekend coming up.
Happy Valentine's Day.
Happy Valentine's Day.
And if you go see 50 Shades of Grey, stand up, don't sit down, right?
Right. And then also, happy birthday, Noodles.
Happy birthday, Noodles. 79 years old. I can't believe my pop is 79. Where does the time go? Well, listen, you're listening to Health Futures, Taking Stock in You. We're a weekly show found right here on Money Radio, 1510 AM, 99.3 FM. Dr. Bernstein, it's been great having you on. Make it a great day, and have a great weekend.
Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 99.3 FM.
Hi, I'm Joan London, and if you're worried about your parent or a loved one living alone like I was, and you want reliable senior care information, then call A Place for Mom, the nation's largest senior living referral service. With one phone call, you'll get free information on assisted living, Alzheimer's care, nursing homes, even important financial information. It's a free service, so call now.
800-379-1174. 800-379-1174.
Money Radio 1510
and 99.3 FM
is KFNN Mesa Phoenix and K257CD Phoenix, where the experts on money gather every day to help you plan your future financial needs with well-timed advice. Dow is up 29 points right now. The S&P is up 4 and the NASDAQ is up 20 points. Right now, oil up $1.38 a barrel.
Just ahead,
Money Radio brings you the latest news, business news, Arizona business news, the weather and traffic, and it all